Today I had the opportunity to lobby on behalf of the New York State Academy of Nutrition and Dietetics. These are the 5 bills we were supporting. Number 1, licensure for dietitians. Currently in New York State, dietitians do not have licensure. That means anyone can practice medical nutrition therapy. This leads to people providing nutrition education that is not accurate and not safe for all people. Different conditions are very complicated, and nutrition for them requires years of training to be able to do it effectively. We need to make sure that people with the proper training are giving this advice. This also would allow dietitians to do things like write orders and labs, which helps gives us more autonomy and gives doctors a break. Obviously, we know there's a doctor shortage and they tend to be really burned out. So the more that we can do to support them, the better things will be. And many doctors would love for us to have order writing privileges. Number 2 is the look back period. Insurance companies can pay providers for a session and then come back and say, sorry, we weren't supposed to pay you. This was actually wrong. And currently they can do that up to 2 years, and we're looking to change that to be 12 months. I ideally would like it to be a much shorter window because providers must submit bills within 90 days, and we're not able to make those corrections. Giving them 2 years to potentially find administrative errors is just ridiculous. And then often when we get these bills, maybe 18 months later, that says, hey, actually, you need to pay us back for this. A lot of times the patients are not really willing to pay the bill at that time. They received care a long time ago. This was not budgeted for them. They don't understand why now they have to pay when it was covered earlier. Then it leaves providers to either send this bill to collections or just not get paid for the session. And as a provider myself, I can say that most providers choose to not get paid for the session. This puts practices at risk, especially small practices, and especially when insurance has large chunks of clawbacks. So if they decide all of these bills from these 2 months are wrong, we're clawing them all back. This can be tens of thousands of dollars that can destabilize small practices. This leads providers to not take insurance or not take as many insurance plans, which reduces access to healthcare for patients. Number 3 is SNAP minimum benefit. Currently, individuals must get at least $23 per month on SNAP. This would make the minimum $100 per household. While this is not enough money to eat an adequate diet, it at least is a good start, and we at least make sure that people who are on SNAP are getting an amount of money that will cover a few meals per month. Number 4 is comprehensive treatment for obesity. This bill is looking at covering obesity medications like GLP-1s, such as Wegovy and Zepbound. In this bill, we would like to make sure that dietitians are also covered. A lot of these drugs lead to malnutrition and also can have issues like nausea and vomiting. It's really important that people are able to work with a dietitian to avoid these issues of malnutrition and also to address any issues they're having with nausea and vomiting. Also, people who take these drugs and work with the dietitian at the same time have better outcomes than people who just take the drugs by themselves. Number 5 is medically tailored meals. Medically tailored meals are meals that are specifically geared to people with different medical conditions, usually chronic conditions. And this helps support their overall health long term. We can tell people what to eat, but if they're not able to make these meals that meet their nutritional needs, they're not going to be able to follow this diet. Medically tailored meals takes that issue out of the equation. It is critical for many people, especially people with disabilities and mobility issues or the elderly. Medically tailored meals have been shown to save money, and they save more money as time goes on. So 5 years out, we see significant savings in overall healthcare costs. So while yes, there's a cost up front to cover the meals, in the long run, it will actually save the state money on things like Medicaid expenses. All 5 of these bills have the ability to greatly impact New York State residents for the better. So I'm so excited that I got to support these and share them with our legislators today.